Welcome everybody. My name is Icó Tóth and I am the co-chair of ENAGAGE. I am also the president of the MALLOW Flower Foundation here in Hungary. I would like to introduce you our recovery helping program. Rehabilitation starts from the diagnosis. We usually think that rehabilitation is just for those who have undergone surgery, treatment and are already recovering. But it is not true. In the palliative care, we can also talk about rehabilitation, which can help for us in soul and in body, in healing and managing the change of life and change of quality of life. You are healed. Go home and live like before, doctor says. But no women with cervical cancer, ovarian cancer or other women cancer live as she was before she was diagnosed. Next to the side effects, sometimes it gets into the squirrel wheel where body problems cause mental trouble and vice versa. Spiritual ordeals are realized in body symptoms. And to improve the quality of life, we need to step out of this cycle in some way. For example, we say that in cervical cancer after surgery, there is a triple loss of function. During surgery, nerves are damaged or lose their function. Ideally, another nerve may take over the function of the injured nerve. Physical dysfunctions have short and long-term consequences and side effects. First is the defecation. During surgery, there is a loss of function at the rectal section, which causes problems with stool sneezing on hospital days. Frequent congestion and difficult bowel movements development. Many practices, preparations, tools can help to optimally manage this function. The second is the urination. After surgery, a permanent catheter is usually placed for 4-6 days to relieve the bladder as it is exposed to a high load during the operation. After that, in most cases, you have to learn to pee again. The method is the abdominal press, which requires a lot of patience to master. As long as the learning process lasts, they may place a suprapubic catheter or self-catheter. Often the urge to urinate is lost. You have to watch the clock to go to the bathroom. Incontinence also occurs as a result of treatment. There are also helping practices for relearning to pee, and there is a barrier muscle gymnastics. The third is the sex life. This is the third emergency physical problem. Radiation therapy has a tissue sinking effect which can result in vaginal narrowing, in some cases complete or partial vaginal adhesion. The smoothness of the vagina changes, decreases. If the ovaries have been removed or shot during radiation therapy, there is no hormone production. In turn, menopause appears, causing the vagina to become dry, resulting in painful sexual intercourses. It is important to know that there is a lubricating and multi-element dilating device, a dilator, for rehabilitation that helps to maintain the good condition of the vagina and to have sex life. Lubricants solve the unpleasant vaginal dryness. Lymphedema is very common due to the removal of lymph nodes. Even stage 1 lymphedema requires attention and lymphatic massage, and other stages also require special treatments. Specialists, physiotherapists, dietitians, sex therapists are available to treat physical dysfunctions, and the MALLOW Flower Recovery Helping Program including all these expertise. Mental difficulties, diagnosis shock, fear of death. Along with the diagnosis, the feeling of fear of death arrives almost simultaneously. It then accompanies the patient with varying intensity. When it comes to death, we are not primarily afraid of how much it will hurt, what will it be like. but we are afraid of those who stay here without us. This is the most painful thing to think about it. Fear of treatments, loss of the opportunity to have a child, fear of losing their partner, fear of finding a pair, fear of recurrences. Talking to fellow sufferers is very important. Many times the spiritual block is already dissolved when they know that what they are going through will happen to others. If they are aware that the many inconveniences they experience are a natural part of the healing process, it is easier to accept it. Turning to a psychologist is also a possibility, and sometimes we need courage for it. We create booklets, videos, ESGO, we have community. It is important to reach the elements of rehabilitation at home too, not just in the institute. So we created a home and an institutional elements with experts. We are producing right now an online digital patient pathway for the gynecological patients. We would like to include our rehabilitation program into this patient pathway to help as much patient as we can. So this is our program.